Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. In studio today with us is Barby Ingle. She's president of the Power of Pain Foundation, also a best-selling author, a chronic pain educator, patient advocate, motivational speaker, and so much more. She's suffering from RSD, or reflex sympathetic dystrophy. She's been suffering for a number of years and has actually gone through the fire with many physicians. It took almost 43 physicians to finally diagnose her correctly and offer her some semblance of proper treatment and relief. She's returning today to talk with us more about her foundation, thepowerofpain.org, and to give us some helpful hints in taking control of our own health care. How are you doing today, Barby?
I'm doing okay. Thank you so much for having me back.
Thank you. Thank you for returning. September of each year is designated as Pain Awareness Month. Being a sufferer of chronic pain yourself, your foundation, Power of Pain, is heavily involved in promoting National Pain Awareness Month. Isn't that right?
Yes, that is right. We actually have done a lot of events this month, and everything from professional education events with the Pain Week in Las Vegas and American Academy of Pain Management Conference in Washington, D.C., as well as local pain summits and expos around the country.
Now, you can't speak of chronic pain without speaking of pain medications and pain treatments in the same conversation. Are you yourself, have you been diagnosed or have you been a user of pain medications? And if so, are you going to be using pain medications for the rest of your life? And is that something that those of us that deal with chronic pain have to look forward to?
I have used chronic pain medications over the years, dealing with chronic pain for 18 years, RSD for almost 14 years. I have used pain medication. At this point, I am using infusion therapy, and there's no opiates involved. I'm actually using a medication called ketamine, which a lot of people think is a tranquilizer, but it's actually an anesthetic that resets the glia in your spine and brain, which turns off signals that reflex sympathetic dystrophy turns on. So it doesn't put you into a cure, but they call it remission, and it helps your pain levels better on a daily basis. And some days my pain is down to a 0, other days it's up to a 3 or 4.
Okay, so are you using this therapy the same all the time, or does it vary based on your level of pain for that particular day?
It's actually similar to chemotherapy. The initial treatment is 7 to 10 days, and then after that 7 to 10 days, you start what they call boosters. And a booster is 2 days long. It's 4 hours on each day, and it's as needed. So sometimes I have gone 2 weeks and then injured myself and had to get a booster. And about 2.5 years ago, I started using what's called an oral orthotic, which is a device that is in my mouth that also helps lower brainstem inflammation, which lowers pain levels. And I've gone as long as 1 year without having to get an infusion or a booster with the use of the multidisciplinary approach with aquatherapy, the infusions, and the oral orthotic use.
Now, with these medications and all of these different procedures that you need to undergo, how much of this takes place at your home around family members?
Oh, goodness. The infusion therapy is not at home. It's in a hospital. Everything else I do at home. And luckily I have an amazing husband who helps me through it all, but he stepped up and has gone to most of my appointments with me over the years and learned how to help me with physical therapy and aquatherapy. And if I'm having a really bad day, he's the brain for me. He can say, well, did you try this? Did you take this medication? Did you try, mindful meditation? Did you try aromatherapy? And he can throw out these different options for me that in the midst of severe pain, I have trouble even thinking of what's available. And so for me, I'm lucky to have that support here with me.
Now, your foundation is working diligently to get everyone to learn why it's so important to not only understand chronic pain, but to spread the word about chronic pain. And in looking at your information, I came across an acronym, PROMPT, being prompt with the spreading of the word. Could you talk a little bit about PROMPT?
Sure. PROMPT, P stands for being proactive. Mm-hmm. You have to be proactive in your care, and you have to be proactive in sharing your story. The only way that we're going to get things to change in society is to talk about what we're going through and make it understandable for the general public. R is for realistic goal setting. A lot of times, many of the conditions that involve pain, you're not going to get your pain down to a 0. You might get your pain cut in half, and that is your goal. So you have to be realistic when you're figuring out what condition you have and what treatment options are available currently as to what you can expect on your daily living and how to manage it. Then O is for open to learning about your condition. Mm-hmm. And like I've said before, you really have to stay on top of what new technologies, treatments, and medications and procedures are available for your condition. M is multidisciplinary. M is multidisciplinary approach to care. And what that means is like in my case, I use a variety of treatment options to keep my pain low, to keep it as low as possible. The higher your pain levels get, the harder it is to get it managed and under control. So you really want to make sure that you're using a multidisciplinary approach. There isn't typically one treatment that takes all of your pain and all of your other symptoms away. So using a well-rounded approach is very important. The second P in PROMPT is for pain reliever should be taken before pain reaches a 9 or 10 to better control your pain. One of the things that I found, especially in hospital ER or overnight care in the hospital, is when you need pain medication, it takes them approximately 45 minutes to bring it to you after it's ordered. So if you know that you are a chronic pain patient, it's better to ask for your medication early so that by the time it's time for your next pain medication dose, that you have it there ready to go so that your pain levels aren't spiking back up to a 9 or 10 that you have to try to manage and get back down, that you're getting consistent care through time, whether you're at home or in the hospital. And P stands for time management leads to better organization and less stress. Time management, I call it energy pennies. The difference between a healthy person and someone who has a chronic disease is that a healthy person never has to worry about their energy pennies. Someone with chronic disease only gets 12 pennies a day, and you have to decide how you're going to spend your energy. And whether that's going to be taking a shower or going to a doctor visit, getting dressed, making breakfast, going to visit some friends or attending a family function, you have to decide how you're going to spend your energy pennies and what things you're going to cut out of your day so that you can accomplish the goals that you have set for yourself that day.
Now, we talked about pain medications. There's so much talk in the news, especially in light of the new healthcare reform that's taken place in the United States, about pain medications, how they're being distributed, who gets them, how long they get them, what doses, and all sorts of things having to do just with the medications that are prescribed for pain. It seems that the policies of the country as far as that's concerned have gone almost haywire. It seems to be almost, some people call it a witch hunt. Other people say that, well, they're tying the hands of doctors who actually want to help people with chronic pain. You mentioned national pain strategy in some of your information. Could you talk a bit about this national pain strategy?
Sure. The National Pain Strategy was developed by the Institute of Health, and they create a board called the Interagency Pain Research Coordinating Committee, IPRCC. They love acronyms in our government.
Yes, they do.
And in 2011, they came out with a Institute of Medicine report that recognized that over 100 million adult Americans are living with chronic pain, and up to 635 billion with a B dollars are spent every year in lost wages, lost productivity, and cost of provider fees and actual care. And so they developed a strategy to help reduce the burden to society, to increase the education of patients, caregivers, and providers, and basically came up with 6 different areas to focus on. First was pain population, or population resources, looking at the racial and financial divides between pain care across the United States. Prevention and care, teaching people at a younger age, which is so important, about good nutrition, good posture, not smoking, cutting back on drinking alcohol, taking the best care of your body, preventing the diseases from developing, or if they do develop, making it not as bad. Disparities in healthcare. It shouldn't matter whether you live in the country or the city. You should be getting good care, especially when you have a chronic pain disease. And that's costing us billions of dollars just in itself with those disparities. Things such as step therapy, prior authorization, and specialty care practices that our insurance companies throw out there as roadblocks and stumbling blocks that they think save them money, but in reality cost them money over time. And then the other 3 areas are service delivery and reimbursement, which is really important for providers to be getting reimbursed for what they are providing to the patients. And also professional education and training, which is something that Power of Pain Foundation really spends a lot of time on with our educational seminars, as well as getting involved in other professionally geared organizations like the American Academy of Pain Management and the American Academy of Pain Medicine. And then the final area is public education and communication. We have to have a conversation in America that lets people know what chronic pain is, what the patients are dealing with on a daily basis, how society, how people can help us live better daily so that it lowers our burden and society's burden with chronic pain patients over time. And so, the national pain strategy is something that really needs to be pushed to be implemented. We know that the government's not going to fund all of the aspects of it, so there's over 50 organizations that have come together through the Consumer Pain Advocacy Task Force. Power Pain Foundation is one of the founding 16 members of the task. And we've come together to show that we have these core beliefs and that we can make a difference and change some of these things that need fixing without funding from the federal government. We can do this on our own. We just have to all work together, and that's what we're doing.
Absolutely.
We're creating a movement.
Now, your website, Barby Ingle, BarbyIngle.com, that's where our listeners can get a little bit more information about you and your personal story. They can go to www.powerofpain.org to get more information about your foundation and your foundation's mission. Where can we get copies of your books?
You can get copies of my books on either website as well as Amazon and your local bookstores.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. It's been an absolute pleasure speaking with Barby Ingle, returning guest, talking about her foundation, the Power of Pain Foundation, and how her foundation is involved heavily in raising awareness and spreading the word about what chronic pain is, how to take charge of your own medical treatment when it comes to chronic pain, and also educating health professionals as to what chronic pain is and how to be more empathetic when it comes to their patients who say that they're dealing with pain that is on a chronic basis. It's been great having you here with us again, Barby.
Oh, it's been great talking to you.
Thank you so much. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.